These are among the surgeries we perform very frequently, especially recently. Labiaplasty surgery. Generally, this name is not widely known. However, it is the medical name for the surgery we perform to correct the sagging of the inner labia in the female genital area. It is labiaplasty. The common name people understand is usually labia reduction surgery. We perform this operation because the inner labia in the female genital area are excessively large and drooping. Having large and sagging inner labia in the genital area usually causes two problems. The first of these is hygiene-related issues. The second is, aesthetically speaking, if the inner lips are large and saggy, it shows outside, causing aesthetic issues for these patients. The third problem is a functional problem, especially from a functional perspective. Functionally, especially during sexual intercourse, because the large and sagging inner labia obstruct the penis, making vaginal penetration impossible or difficult, it causes severe pain. Our female patients express that they feel severe burning pain. Basically, to resolve these three problems, the hygiene issue, the aesthetic visual problem, and potential issues during intercourse, we must perform labiaplasty or labia reduction surgery. We should perform it. We can do labia reduction surgery with local anesthesia. Alternatively, what I prefer and recommend more to my patients is that we can do it with sedation. When we perform the procedure under sedation, it eliminates the need for general anesthesia during the operation. However, you will be asleep throughout the entire surgical process and will not remember anything. The average surgery time is 45 minutes. After the surgery, we can have the patient rest in the hospital for 3 to 4 hours and then send them home. We can discharge you. I want to mention a few things about the surgical technique. In cases of sagging lips, meaning when the inner lips are large and drooping, if we say we will cut and stitch them from the root, this is a very simple procedure. But this is not the correct aesthetic approach. We must perform the surgery in such a way that your inner labia are preserved but do not extend beyond the outer labia. They should remain between your outer labia and not be visible, so that it does not create any issues or difficulties for you, considering hygiene, functionality, and aesthetics as well. Consequently, by being more meticulous here, we need to use various and different techniques, which we refer to as flap techniques. We must reconstruct the inner labia by completely redesigning its required shape. Sometimes when designing this, we also need to address the areas around the clitoris. This in turn allows our female patients to experience an even greater degree of pleasure during sexual intercourse. Thus, an extra benefit emerges in this way. The most basic thing patients must watch after this surgery is this, viewers. We must enforce sexual abstinence for approximately 1 month, especially after the surgery. This is because the site of the operation is precisely at the entrance of the female genital area. Therefore, if we attempt sexual intercourse immediately after the surgery, the risk of damaging the performed surgery is very, very high. So, during the 1 month abstinence period, we allow time for the surgical area to heal. And after 1 month, you can return to your active sex life as you desire.